And now for the last of these excellent presentations this afternoon, and I hope it will be a way of tying together some of the principles, ideas that have been discussed over the last hour and a quarter or so. I'm John Lawrence from the Chronic Illness Alliance. We've been undertaking an exploratory piece of work over the last few months, looking at models of self-management and peer support and how they can link more effectively to general practice and to the role of practice nurses in particular. General practice in some ways hasn't changed a lot over the years. But we are aware currently that there's a massive reform initiative on in this country, and we've got great challenges to address in terms of the increasing burden of chronic illness, the potential for large proportions of our population to be left out of that process, and the need for primary healthcare services, and notably general practice, to take a key role in ensuring that all of our population are well served and maintaining the highest level of health and well-being that's possible. My presentation, I'm having a little bit of difficulty because my little laptop screen here doesn't seem to feature the slides on that are up on the... Oh, here we are. That's much better. There are three simple objectives for this presentation today. The first one is to look at the rationale for integrating health self-management support and peer support into your practice of chronic disease management. Secondly, to look at that issue of the barriers, what's preventing us from integrating those components more extensively. And thirdly, some practical opportunities and models that might enable us to overcome some of those barriers. There's our overview, but I'll move rapidly through it. I'm a manager at the Chronic Illness Alliance, which I'll explain a little bit of in a second. I'm a psychologist by background and have done a lot of work in research and education, particularly with the Flinders University, what's called the Flinders program, which you may have come across. So my perspective is particularly around how do we utilise the best psychological principles and understandings to strengthen our processes of chronic disease management. At the Chronic Illness Alliance, our focus is improving the quality of life for all people with a chronic illness through education, research and advocacy to government. Our perspective is very much that of consumers, often with multiple conditions, struggling to maintain that quality of life. We have some 55 organisational members, their Heart Foundation and cancer and diabetes and asthma and arthritis, etc. Plus some 90 members of our peer support network, a large number of health professionals. And our target audiences include those health professionals, consumers, the community at large, and certainly governments at all levels. Our key challenge is to improve the chronic care models that we're using. Many of you have seen the Wagner model of chronic care, and what it features are 6 key ingredients. The organisation needs to be committed to that chronic care. They need to utilise those broader community resources like the peer support groups. They need to integrate self-management. They need those delivery systems, and we've seen some excellent examples of those this afternoon. They need those decision support tools, which with the chronic kidney disease we've just seen illustrated. And they need good clinical information systems, the good databases. So Is there anyone who hasn't seen this diagram? Good. Because it is, I think, worth continuing to go back to remind us of the key components that we need to bring together to be effective in creating those productive interactions between ourselves and our patients. I'm particularly focusing here, out of those ingredients, on that self-management support component and peer support. So health self-management support involves two components: the educating of people about their condition and effective self-care, and the motivating of them to care for themselves better, and encouraging them to sustain that using the tools and techniques that are going to enable them to sustain those changes in the long term, not start off with good ambitions and find they fall over with those. Self-management support is both a set of techniques and tools and that collaborative partnership, building that rapport. Some people enjoy their particular nurse practice, and others see it very much as a human experience of educating, of engaging, of building those partnerships with their patients and their families. When we talk of self-management, we talk of a wide range of different components, some focusing more on information or behaviour change, on those self-efficacy or self-effectiveness skills, or on technical skills. To be effective, we need to weave in components from all of those areas in relation to the particular needs of our patients. That weaving those components in and tailoring them to the individual is how we're going to get optimal outcomes, health outcomes. Moving on to peer support. Peer support can involve elements of telephone contact, emailing or face-to-face conversations. The coach program, for example, that's evolved from St Vincent's, has been an excellent telephone-based support system. It may involve groups that meet regularly or increasingly internet connections. Most programs enable or use peer support volunteers or leaders who've come to terms with their condition and are trained to use their personal experiences to help others towards greater well-being. Most people are attracted to peer support in order to gain support and encouragement on an ongoing basis, to enable them to make sense of their experiences, to feel less isolated and alone, and to come to terms with the significant changes that are likely to occur in their lives. And perhaps peer support programs and groups can offer an excellent complement and extension to the roles that you're evolving as practice nurses to emphasise and continue building some of those components that I'm sure you'll be working on already. Experienced peer support volunteers or leaders also provide significant role models for recovery, for empowerment, and for building confidence in those people with a chronic illness. Very full slide this, I'm not going to go through it all, you'll be relieved to hear, but there's an increasing body of evidence to indicate that peer support does give people a wide range of opportunities. And at the Chronic Illness Alliance, we've done a large international literature review and built best practice principles and framework, both of which have been acknowledged across Australia and internationally in identifying what is best practice, how do we achieve it, and what are the outcomes that are likely to flow from it. However, peer support programs are not about providing professional counselling or providing a medical service or interfering with treatment. And those that are trained to be leaders, to operate peer support, whether they be volunteers or health professionals, need to be very clear about that. Because we do find that GPs in particular are often wary about peer support groups, uncertain of the quality of care or the quality of advice, and need to be reassured that there is a quality process involved. So, in relation to health self-management and peer support, there is a degree of scepticism out there as to whether we are there yet. And one nurse commenting when I've done quite a lot of consultation around these issues, and her feeling was that we don't know how to do this stuff properly or completely yet. We haven't put all the pieces of the puzzle in place. Or to look at it a slightly different way, with a patient-centred approach, which we're all aspiring to, surrounded by many other pieces that are pulling at that approach, we haven't fitted the self-management and peer support components in successfully and effectively or smoothly as yet. Some practical models then. Many of you may sometimes feel that and I've heard comments this afternoon, that your role, at least in the past, may have been more as a servant to the general practitioner. However, there are a number of roles that are evolving well beyond that. One of them, from a diabetes educator, has identified the significant challenges or barriers to implementing good self-management support. The time available to use the more thorough programs like the Flinders program that are well grounded in cognitive behavioural therapy, an evidence-based program that enables people to make and sustain change. There's of course, as we've heard this afternoon, the fee-for-service, the business model that needs to be to support any initiatives, and there's often a focus in other directions and a lack of recognition of the value of self-management. This particular diabetes educator, however, indicated that there's significant opportunities in service redesign through practice nurses specialising through additional education in issues like diabetes or even in immunisation. A little bit of personal background. My father is shortly to finish 60 years service as a GP, so I have had lengthy discussions with him for a long time, including last night, on trying to understand how this is operating from his perspective, along with many other GPs. And that was certainly one of the things that he saw evolving over particularly the last decade of his contribution to the general practice. There are, however, practices that are specialising increasingly in a particular disease. In Adelaide, for example, I work with a general practitioner who was specialising in diabetes management and very successfully attracting people from a wide area and making a lot of money out of it. He was only too happy to reveal. There are collaborative specialisations where a visiting allied health practitioner can come in and therefore enable the practice to expand in that area, or not need to develop or employ a particular person. But there's also the application of services strategically, such as utilising hospital in the home programs to opt out of having to have home services delivered. Opportunities for practice nurses. Some of the nurses commented, the diabetes nurse for example, that there are opportunistic conversations for raising issues of better self-management and perhaps the support that peer support groups can offer. You've undoubtedly come across the stages of change model to match the readiness of a patient to make certain changes with the actual plans that you're developing for them. An invaluable tool and reminder for us. You may well be using currently those what are often described as fairly open and vague comments in the referral from a GP to initiate and explore further the issues. The advocating on behalf of patients is clearly a significant and a useful role. Increasing active self-management, where patients are directing what they need, can all lead to, as we've seen illustrated this afternoon, I think, and is illustrated in many other contexts, improvements in HbA1cs and BSLs. In an aged care, in a practice that has a very high proportion of older patients with multiple conditions, there is a specialising of nurses across a range of different roles, from the triage to identify what the issues are and to be able to direct them quickly onto the appropriate servicing, through to people specialising in the health assessments, to immunisation and to a range of other functions. In asthma, and I've been consulting with the Asthma Foundation about this, there's a wide variety of practice, the management of people with asthma, depending significantly on the level of education and confidence, but also the perception of asthma as a management as a priority, as we saw with chronic kidney disease in the previous presentation. And even the construct, the perception in some cases that it isn't a chronic disease or condition. Current usual practice may often include a device demonstration, a drafting of an action plan, symptom management, and medication reviews. However, one of the key problems seems to be not so much that there's a lack of information, but of misinformation, and the need for greater training, awareness and quality improvement checks to ensure that practice nurses are significantly assisting the improvement of asthma management rather than undermining some of it. So current best practice includes people undertaking asthma education, following up diagnosis, ensuring that there's a regular and appropriate medication review. There are checkups and reviews on patient use of asthma devices, and the inclusion of vaccinations as well. Potentially, practice nurses can play a significant role in managing asthma better. They do require additional education. The Asthma Foundation was keen to insist that they have a lot of information and equipment available to assist, so that we do get a better focus on improved rates of follow-up, a regular review. I'll just jump through these, but suffice to say that we are on the cusp of a global revolution in primary health care in relation to the use of information and communications technology that will transform the relationships between our patients, particularly our younger and middle-aged patients, so that we have quite different patterns that lead to that successful health and wellbeing outcome that we're all desiring. For the Chronic Illness Alliance, we're working in a range of ways to deliver this through the Medicare locals, through NARI and U3A on online education for patients, with the Australian Centre for Health Innovations on developing new tools and techniques to support people in self-management, and with Oasis Graduate School in developing new health and chronic illness units within their programs. Some take-homes then. There's clearly evidence of benefits for patients and for general practices in adopting self-management and peer support as a support to that. There are opportunities for health self-management and peer support, but they're as yet significantly underutilised relative to some of the best practice models around. We do recognise there are barriers persisting, but ultimately we are confident that practice nurses can play a key role in finding those creative practice solutions to integrate health self-management support and peer support principles and practices into current assessment and care planning, putting those pieces in place, as we've seen well illustrated, I think, in the previous 3 presentations. We all aspire to those close relationships that are effective, and I thank you for listening. Any questions? We're all ready for afternoon tea. Okay, thank you.
Thank you, John.